Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today, we're talking about deadline maintenance, remembering key BadgerCare Plus deadlines. Now, we do have a couple links that you might find of interest, and you can visit those by clicking on the information button you see at the bottom of your screen. Deadlines are important not just for submitting applications, but also for submitting backdating requests, for getting in verification documents, and for key procedures like express enrollment. We'll talk about a couple of those today. Now, the end of the month, an application deadline reminder. Consumers and advocates need to keep the end of the month, the last business day of the month, in mind when they are applying for public benefits. In the world of BadgerCare Plus, if you get an application in by the last business day of the month, that could mean that you have coverage for that whole month in which that application was submitted. It might even extend further. Keep in mind this has to happen before your local consortium closes. Some close at 4, some close at 4:30, and sometimes the end of the month is not when you think it is. In the month of July 2017, the last day of the month is July 28th. It's a Friday, the last business day of the month. Now, we did say maybe you can go back further in time, and backdating is a possibility for some people in BadgerCare Plus. The rule is generally that if you get an application in before the end of the month, that application can go back in time and cover that whole month, but it might also be able to go back 3 prior months if you would have otherwise been eligible in those months had you applied. There are some exceptions. It looks at the age and income of children to determine if backdating is appropriate for children, but generally for adults, backdating is a possibility if eligibility would have otherwise happened in those months. Now, we do have a separate video case tip that looks at backdating a little bit more closely, but you could see if you submitted an application somewhere in the middle of June, you could backdate potentially back to the 1st of March. So getting an application in before the end of June, for example, would make sure that you could go back as far as March. This would be critically important if somebody had a first instance of a hospital bill in March and didn't get around to applying for BadgerCare Plus until the month of June. If you wait until you roll into July to submit an application, you're going to lose out on that potential opportunity to backdate to March coverage and get that bill covered. So remember the opportunity to do backdating, but also the linchpin is that end of the month deadline, and that could happen before you even realize it. So it's always a constant reminder to advocates and to applicants to make sure they're paying attention to date and time when they're submitting an application. Verification documents. Remember to submit them in a fast manner. You typically have into 10 days of the following month in which the month in which you applied. If you apply the very last day of July, you only have 10 days into the following month of August to get your verification documents in. This is the most commonly missed deadline in the world of BadgerCare Plus and public benefits. If a verification request is submitted, please respond as soon as possible. You can get an extension in some opportunities if you call the Income Maintenance Consortium and talk with the worker and give them an explanation that you've been trying to get the verifications in, you might just need a little bit more time. Keep in mind, if you are really struggling to get verification items in, you should also let your worker know, and the duty then shifts to them to accept the best available information and to help out where appropriate to try and get those verification items. There really should be no excuse for someone who in good faith effort is trying to get verification items and they can't. The consortium needs to step in and accept the best available information. A really good tip, and we do have a separate video case tip on best available information and verification items as well. The deadline here, though, is that 10 days into the following month. That comes up very fast, especially if you think about somebody that's applying for public benefits and they might be in the hospital or tending to a sick loved one. 10 days into the following month sneaks up awfully quickly on folks. Express enrollment. Now, you might be familiar with the process of express enrollment. This allows someone to get presumed eligible for BadgerCare Plus when they are in a healthcare facility or they have met with an approved express enrollment provider. Now, the linchpin is that only lasts for a short duration of time. In order to have your BadgerCare Plus continue, you do have to fill out a complete BadgerCare Plus application. Express enrollment only lasts for a temporary month, and this only goes to the end of the month following the month in which you applied. If you applied in July, your temporary enrollment will be good only until the end of August, and then it ends for good unless you complete a full BadgerCare Plus application. Just like verification deadlines, that 30 days usually will creep up awfully fast, especially if you apply at the last day of 1 month and you only get 30 days into the next month. You're going to want to make sure that that gets calendared and that the healthcare provider is staying on top of things as well. They should be making sure that they continue that process with you, give you a full BadgerCare Plus app, or help you fill out the application to make sure that your benefits can continue. Once those benefits ends, you're done. You get your express enrollment and you have to continue the application or your benefits will end on a hard and fast deadline. Deadline maintenance is always an important advocacy tip to share with advocates and applicants. Keeping these deadlines in mind early is going to prevent problems and headaches later. Use your calendar, use your computer's calendar, set a reminder on your phone, but make sure that you have these deadlines marked and they're flagged. The consequence of not doing so could mean millions of dollars in hospital bills. It could be surprise bills, and it could mean a loss in coverage. We share with you the BadgerCare Plus Eligibility Handbook, Chapter 25.8, where it goes into a little bit more detail on this topic of some of the deadlines we've talked about. If you have any questions, you can also contact us at ABC for Health. Thanks for joining us.